welcome Dr. Jenny Yip to the My Light Away podcast. We have such an important episode today, all around postpartum mental health, and we're going to be getting into what postpartum and perinatal anxiety and OCD look like. Dr. Jenny Yip is a board certified clinical psychologist, author, and speaker with over 2 decades of experience treating OCD and anxiety disorders. And drawing from her own experience with OCD, she has dedicated her career to helping individuals and families overcome mental health challenges. She serves as a clinical assistant professor of psychiatry at USC Keck School of Medicine and founded the Renewed Freedom Center in Los Angeles and the Little Thinkers Center. She is also the author of 2 books on managing anxiety and co-host of the Stress Less Life podcast and developed the Stress Less Mama Masterclass. So welcome, Dr. Jenny, to the
Thank you.
podcast.
Thank you. So excited to be having this conversation with you.
Yeah, I'm excited to dive into it with you. And before we do, I know I just gave your intro, but I always love to understand, where is this passion of yours coming from and what's your why underneath the work that you do today?
Yeah, so I came from a family where many of us had OCD or still have OCD, and yet back in the 70s and 80s, nobody knew anything of it. And I suffered from OCD since the age of 4 is the earliest that I remember. And then I didn't realize it until I was in college, to which a professor noticed me writing in the racing, and asked me about it. So I was lucky and fortunate enough to match to a internship program that specialized in obsessive compulsive disorder, the Behavior Therapy Center of Washington, led by Dr. Charles Mansueto. And that was where I had my first understanding of OCD, even though in in undergrad, I studied psychology. I majored in psychology, and I had no idea what OCD was. So that took me on the path of treating people with OCD. And then I became pregnant with twins. And I never realized that I would have to struggle with OCD again. And lo and behold, postpartum, very quickly, I started getting into the OCD anxiety cycle again. And even as an expert at that time, I didn't recognize it was OCD. And it wasn't till one of my mentors, Dr. Barbara Van Noppen, pointed out to me, Jenny, I think that might be OCD. And boom, the light came on. And I was
Mm.
like, holy moly. Yes, I've been struggling with OCD again. So that set me on the path of focusing more attention and awareness on maternal mental health because even as an expert at the time who treat obsessive compulsive disorder, I didn't know it. My providers didn't know it. They certainly didn't ask me any questions about it. And as I dug deeper into the research, there was not much out there about perinatal or postpartum obsessive compulsive disorder. And that's why I ended up writing my book, Hello, Baby, Goodbye, Intrusive Thoughts. That was one of the first to focus on this debilitating condition and, to give space and awareness for all mothers, whether you're a new mother or a veteran mother, to have the confidence that this is real and it's very treatable. And more importantly, there's no shame around it because there's so much stigma around perinatal and postpartum OCD that a lot of mothers are afraid to disclose their intrusive thoughts, which leads to all of the misdiagnosis and lack of diagnosis.
I'm so happy you're here to have this conversation. And what a profound experience you've been on from, your professional experience, but also your lived experience as well to really be able to understand and speak to what people go through.
Yes.
I've noticed over the decades that there is more awareness and more conversation happening around maternal mental health, but like you said so well, not as much around OCD. And even in, the prenatal screens and in the postpartum visits, they'll, ask like the Edinburgh Depression Scale or different symptoms. They'll sometimes assess depression, sometimes assess anxiety, but there is a lot less out there and a lot less awareness and conversation happening around OCD. And I hope that even through conversations like this, we can help reduce and release some of the shame and the stigma around it and just bring light onto, I'm even hoping we can start the basics. Like, what is OCD? How is it different than anxiety? And how do these symptoms tend to show up in the perinatal period?
Yeah, those are some really great starting points. And the thing about OCD is that a lot of people think that it's rare, it's uncommon. And therefore, like you said, providers aren't really asking about it, even though research now shows that it shows up a lot more commonly than what we had thought, especially during the perinatal and postpartum period. So let's do the basics. What's OCD? In obsessive compulsive disorder, you have to O and then you have to C. And obsessions are basically any type of intrusive, unwanted thoughts, images, sensations that you have that you do not want, that doesn't sit well with you, that doesn't align with who you are and your value system. Okay. So, of course, if you're having intrusive thoughts that you do not want to have and they're repetitive, so imagine having a nightmare that keeps replaying like a broken record, you're going to want to get rid of it, right? You're going to experience a lot of discomfort, a lot of anxiety, and therefore, we engage in what's called compulsions. Compulsions are basically anything that you do, whether it's a physical thing or a mental thing, or even an emotional thing that you do in order to neutralize and get rid of the initial obsessions.
Mm,
So, for an example, let's say I have a common intrusive thought during the perinatal period of dropping my baby. What if I drop my baby, right?
right.
Very common.
Yep.
And you go, oh my goodness, that is a scary thought. Well, now I'm thinking about it. I'm thinking about it, and my anxiety is getting worse. So obviously, I need to get rid of the thought, right?
Right.
So now I'm avoiding stairs. I'm avoiding anything, any heights where I can drop the baby. Maybe I'm even avoiding baby themselves, right? To
Right.
avoid because what if, right? I must be careless or neglectful because why else would I have such a thought?
Right.
And therefore, I could be avoiding baby altogether. And in doing so, I get relief temporarily because the truth is, the intrusive thoughts will always come back. And the more we try to stop the thought, the more we try to um, manipulate the thought, the more we're actually giving attention and space to those thoughts that we're trying to stop. So then the cycle becomes stronger and stronger. And the more you engage in a compulsion or avoidance behavior, the more the intrusive thoughts come back. Which then, for a new mother who is sleep deprived, mood is everywhere, you're completely depleted of energy, of mental bandwidth, you're going to start believing there must be something wrong with me in terms of my health or my mental health, something wrong with me in terms of my character as a mother.
Mm,
And then, because you're adding that shame and stigma to yourself, you're afraid of your own thoughts. And you might not disclose your thoughts to the people who care about you most, your partner, your family members, and perhaps not even your providers, because who knows?
Mm. Yeah, there's a lot of fear that could come up with saying those thoughts out loud.
Right.
Yeah.
Yes. And the truth is that a lot of providers today still don't have an awareness of what OCD is. I think um, in our media, we portray OCD as these quirky behaviors, like what you see in the movie, right? In the Jack Nicholson movie, it's kind of quirky. You're stepping in and out of doors and you're hopping over lines and you might be doing a lot of washing. Except these are just very um, stereotypical portrayals of OCD. Not that they don't happen. Yes, washing, counting, repeating. Yes, those subtypes do occur. However, there are so many types of OCD because OCD tackles what you care about most. And during the motherhood period, whether you're in the perinatal, prenatal, or postpartum period, what you care about most is going to be baby, health and safety of baby, health and safety of yourself, health and safety of your environment, health and safety of going through labor. So, what you're going to care about most is what will trigger the obsessions.
Mm.
Now, you tell a provider who doesn't really have an awareness of what OCD really is and says, you know what, I have been spending a lot of time worrying about the types of food I'm putting in my body, the toxins that might be in my skincare products, the toiletries or detergents that we're going to be using when baby arrives. And it's giving me a lot of anxiety. And I have been going down the Google hole
Yeah.
to research and figure out what is safe, what's not, what has what ingredients in it. And I spend hours in a day to research and check and seek reassurance. And your doctor might just say, okay, you're just very, very anxious.
Right.
And then they might reassure you and tell you there's nothing to be worried about, and maybe even tell you everything will be fine, except reassurance is a form of compulsion.
Mm.
Because what does reassurances do? Reassurances serve to give you temporary relief. Ah,
Yeah.
the problem with that is that OCD thrives on doubt. So,
Mm.
based on the uncertainties of life, never knowing exactly what the dangers are, exactly what might happen, OCD's goal is to close the loop on the uncertainty piece. And therefore, because your mind can always go down that what if train, well, what if? What if my doctor wasn't really 100% certain? What if my doctor really didn't know what they were talking about, right?
Yeah.
So then you start ruminating again. You start worrying again. You start checking, seeking reassurance in order to gain 100% certainty, which doesn't exist
Right.
because, according to Benjamin Franklin, the only certainties in life are death and taxes. So, unless we're questioning death and taxes, um, it's always going to be filled with a bit of uncertainty.
Yeah. That loop keeps reopening and going.
Exactly.
What would you say? Is there a distinction between anxiety and OCD because, anxiety, intrusive thoughts are a common symptom of anxiety. Do you
Yes.
do you know or can you articulate the difference?
Absolutely. When it comes with obsessive compulsive disorder, there is the anxiety piece. Because again, as I said, if you're having intrusive thoughts that doesn't resonate well with you, you're going to feel uncomfortable, you're going to feel anxious. However, the type of intrusive thoughts that comes with obsessive compulsive disorder is going to be very different
Mm.
than what comes with perinatal anxiety. So, for example, in perinatal anxiety, new moms or veteran moms are going to be worrying about real life common concerns. And two of the common anxiety disorders that occur during this perinatal period is generalized anxiety and panic disorder. Okay. So generalized anxiety disorder is worry about everyday life, finances, family, children, career, your neighbor, right? These are common worries.
Right,
So you might be worried about whether you have the financial resources for this child. You might be worried about, well, if my child gets sick, what do I do?
right.
You might be worried about different health conditions that you or your child might have. So these are very common worries. And the thing about generalized anxiety disorder that is difficult to navigate is that it does cause a lot of rumination, right? You're going to ruminate and ruminate and ruminate, and you might do the checking and seeking reassurance, except that is a mother's misguided attempt at finding a solution. Okay,
Mm.
you're just ruminating and ruminating and ruminating
Yeah.
in order to find a solution that isn't good enough. Okay, not
Mm.
that it won't work, it just might not be good enough. Whereas panic disorder is when you feel um, like there's something wrong with your body. You feel your
Yeah.
heart palpitating, you feel the difficulty breathing, you might feel your shaky limbs. And what you fear is experiencing that out of your control. Generalized anxiety disorder tends to be more common in the prenatal stage during this
Okay.
period, whereas panic disorder tends to be more common during the postpartum stage. Now, you're probably wondering why, right?
Mm.
So think of a new mother, you're pregnant, and your hormones are raging. You're in your first trimester. You don't know whether this pregnancy will survive or not, right?
Yeah.
Everyone, including your providers, is giving you all sorts of warnings. Be careful of this, be careful of that. Don't eat this, don't eat that. Don't do this, don't do that. So, like your whole first 12 weeks of being pregnant, it's just warnings. So, naturally, your mind is going to start ruminating about all the potential dangers out there that might impact your pregnancy, right? Then during the third trimester, oh my goodness, baby's about to come. Are you ready for a baby? Do you have the car seat installed? Do you know how to work the car seat? What gadgets are you going to buy? Which stroller? Which crib? Which car seat? So many decisions to make,
Yeah.
right? Are you going to make the perfect decision? The best decision because you're a great mom, right? You're an invested mom. And therefore, you want to make the best decision there, which doesn't really exist because if it existed, there will only be one car seat. There will only be one stroller out there. But because of all these different decisions, you're going to start ruminating. You're going to start checking. And then during the postpartum period, you have moms who, if they previously suffered from panic disorder, well, this is where you might fear going out of control, right? You might fear, well, what if I'm holding baby and I have a panic attack? What would I do? Right? I can't hold baby while having a panic attack. And the thing about panic attacks is that you never know when it's coming. That's why panic attacks become so scary because
Right.
they just come out of the blue and they go from 0 to 10 in 0 seconds, and you just feel completely out of your body. So, what if I'm holding baby while I'm having a panic attack? Worse, what if I'm driving baby to the pediatrician appointment and I have a panic attack, right? So this is why panic disorder occurs more during the postpartum period, whereas generalized anxiety disorder occurs more during the prenatal period. Now, how are these different than OCD? Okay, let me give you more common intrusive thoughts related to OCD. What if I suffocate my baby? What if baby just keeps crying and crying, crying, and I can't take it anymore and I put a pillow over baby? What if I'm bathing baby and I let baby slip and baby drowns? What if I'm putting butt cream on baby because of a diaper rash and I'm looking at their genitalia a little bit too long, and that might make me a pedophile? Right. So the thing about OCD intrusive thoughts is that number one, the harm thoughts could be intentional, could be accidental, or it could be natural. For example, SIDS, right?
Mhm.
So because the thoughts tend to be a little bit more extreme, much more irrational, the compulsions are also going to be much more extreme and much more irrational. So I can even give you an example when I was pregnant with my twin boys. And yes, I did the whole contamination fear, right? That's really common. So I worried about how clean the milk bottles were, whether they were sterilized well enough or not, how they were placed to let them dry, what would be the least contaminated place to store all of the baby gadgets, right? Yes, I went through all of that, which is common. However, one of my uh, biggest fear that I didn't recognize was OCD until my mentor mentioned it was I feared that I would treat my twins differently.
Mm.
So I had twins at 40, and I loved them so much. And my fear was that I would treat them differently, whether, physically or emotionally or mentally, and I would do irreparable damage to them,
Mm.
like, you know, emotional and mental damage to them.
Right.
So that obviously caused a lot of anxiety for me. So what did I end up doing? Well, silly things now thinking back to it, but at the time it made complete sense.
Yep.
Breastfeeding. Oh my goodness. I was a milk factory to these milk addicts. And I had to make sure that I gave them the same amount of milk. Now, how in the world do you do that while breastfeeding?
Right.
Right?
Yeah.
And here I am trying to figure out some mathematical calculation, like how long have I been nursing them, how much time they were awake versus asleep, it was just crazy, right? Just so that I can say it was equal and I
Right.
wasn't favoring one versus the other,
Right.
right? Something else that I did in the evenings, or actually, what am I saying? Not in the evenings, time I could have gotten sleep. Instead of sleeping, I would be going through my memory bank of what did I do with one twin versus the other? what kind of emotions did I have for one twin versus the other? How was I thinking about them,
Mm,
one twin versus the other? And it's like, how in the world do you even quantify these things, right? But these were my compulsions. Now, if I tell that to any medical provider who is uninformed about what OCD actually is, they're not going to know that's OCD,
right.
right? They're just going to
Yeah.
say, well, you're just anxious or you just might be crazy, right? Or they might even think I'm dangerous.
Mm,
And that is the scary part that keeps many new moms from disclosing. Because what if I told the provider, I have been having thoughts of dropping my baby, dropping my baby on the ground, dropping my baby in the tub, dropping my baby on the stairs, dropping my baby. And I think I might be a danger to my baby.
right.
Okay.
Yeah.
The provider might agree. The
Right.
provider might then put me on a 5150 hold, right? A 72-hour psychiatric hold,
Yeah.
right?
Yeah.
Because the provider not only doesn't have an understanding of what OCD is, the provider didn't ask necessary questions to differentiate whether this is intrusive obsessive compulsive disorder or is it psychosis.
Right. Yeah.
The
Then,
two are very, very different.
yeah.
The thoughts that come up might feel different, except the purpose of the thoughts are completely different.
Mm, yeah.
So when it comes to intrusive thought, again, intrusive means I don't like the thoughts. I
Yeah.
do not want to have the thoughts. The thoughts don't align with my values and how I see myself as a mother,
Yeah.
right?
Yeah. I think you said that so
That means,
well about the contradictory piece with your values.
yes,
You're like, why am I having this if it
right,
wildly contradicts with what you actually want?
absolutely. So, whereas when it comes to thoughts that occur with psychosis, the mother cannot tell whether this thought is real, reflects reality, or not. The mother truly believes that the thoughts are real and that she has to do something to save her baby. They're meant
Right.
to be altruistic. Thoughts like, I'm the only one who can protect my baby. And God told me that my baby has been possessed. So I
Mm,
need to save my baby's soul, right? That sounds very, very different, except there are nuances where if you're not asking the why questions, the intentions behind the thoughts, that's where many providers get it wrong. And
yeah.
if you're going to put a new mother on a psychiatric hold, guess what? You have just reinforced her fear that she's a danger.
Yeah.
And that is going to make the treatment a lot more difficult.
Yeah. You've done more damage unintentionally by trying to help. So I'm thinking, say if any of the listeners are resonating with this experience, but then a lot of healthcare professionals are not trained to recognize and treat OCD. Maybe while she looks for someone qualified to who specializes and help her with this, maybe you have other advice as well. What can she do in the meantime to help herself?
Well, the thing is, first of all, we got to put the shame away. We
Mm,
have to put that stigma down because remember, you have these thoughts not because you're a terrible mom, not because you really want to cause harm, because you care. You care deeply about your infant, your
mm,
newborn. You deeply care about your pregnancy, right? Remember, OCD tackles whatever you care about most. And during the motherhood period, this is your priority. So,
Yeah.
of course, your thoughts will naturally go into that direction. So, rather than labeling yourself as a terrible mom, label this as OCD.
Mm,
Okay. First and foremost. Second of all, many moms are in that fix it mode. We want to fix everything. We want to find solutions. We want to fix things. We want everything to be perfect. Okay, take a pause. Because in the OCD cycle, fixing it means doing compulsions
right.
to get that relief.
Yeah.
That's not going to work here. That's only going to reinforce the cycle even more.
Mm,
So, first, label OCD. Second, pausing instead of reacting and getting into that fix it mode. Third, your biggest goal as a mother is to build tolerance to discomfort. And I say this
mm,
because having intrusive thoughts is one thing, motherhood is a whole beast in itself. And you are going to go through so many different levels of discomfort and fear and various anxiety moments, and you have to learn to be able to sit through the discomfort whenever uncertainty increases,
mm.
taking a pause before you respond in a way that aligns more with your values and your intentions in parenting. So those are the three steps.
Mm.
uh,
So,
and then what I would say is, if you're looking for a treatment provider, so let's say you're practicing these things. Let's say you have uh, light OCD symptoms or even light anxiety symptoms, and you're taking these three steps, labeling it as OCD rather than making a judgment of yourself, pausing rather than reacting, and then sitting through the discomfort without doing anything, and it's not working, I would say it's really important to get help early, because when you get help early, you're reducing your own suffering. However, keep in mind, during the fourth trimester, it is the most crucial time for bonding.
mm,
It is the most crucial time for attachment. This is where you're building that relationship that will take you, you know, a long way until they graduate or until they leave the house, right? So you want to make sure that you're really utilizing this fourth trimester for what it's meant for. And if you're mentally preoccupied by intrusive thoughts, then that takes away that special time that you need for
yeah.
bonding.
So well
So
said.
getting the help early.
Yeah. Yeah. On that note, because early intervention is optimal if you're experiencing symptoms. If you are someone who maybe you've had OCD symptoms in the past, maybe you've had anxiety in the past, maybe you might be at more risk. Are there any preventative steps that someone could even start taking in pregnancy to help that be the focus in the fourth trimester?
Absolutely. So remember how we talked about that anxiety cycle?
Yeah.
Whether it is OCD or anxiety, whenever you're getting yourself into avoidance mode or compulsions, or you're escaping, or you're seeking reassurance, well, that's your red flag that you're actually reinforcing and strengthening your anxiety. So, is it necessary to check ingredients and just have an awareness of what's safe and what's not? Sure, right? Because this is an important period. However, is it necessary to be checking and going down that Google hole for like 2, 3, 4, 10, 15 hours a day? Absolutely not.
Yeah.
If you're spending excessive time checking, seeking reassurance, or in avoidance mode, then that's a red flag for you.
Mm.
So instead of checking, okay, check one site. The problem with social media and having all of the content that we currently do online is that everything says something different.
So true.
So
Yeah.
when you're reading one thing and then you're hearing another and they kind of contradict each other, what does that do? Well, that raises uncertainty. And anxiety and OCD thrives on uncertainty. So it's
Hmm.
actually making it worse.
Right.
Rather than reading, you know, 20 different things in order to try to narrow it down, right?
Hmm.
Read one, read three, no more,
Right. Do
right?
it intentionally instead of getting looped in.
Stop.
And I
Yes.
think so much comes back to the awareness piece that you were talking about. And that is, I find the first step to so many things related to mental health. It's bring awareness to where is this coming
Yes.
from. And so by instead of responding how you would normally respond, respond by sitting with that discomfort. Will that
Yes.
over time rewire and create new neural pathways, new responses?
Absolutely. Yes, because what happens with your brain when you start to do that what if train is that your brain goes into alarm mode,
Yeah.
right? Your brain starts to believe something needs to be fixed, something needs to be done about that, and it intensifies the catastrophic thinking, it intensifies your body's fight or flight alarm system.
Mm,
By sitting there, naming it for what it is, and taking a pause, you're actually building your tolerance for discomfort. And that changes the neurochemistry of your brain, that it doesn't have to be in reactive mode, that there really isn't a fire to be put out, that this fire alarm is actually a false alarm. So you're retraining how your brain chemistry works. You're retraining the system that previously was maintaining that anxious fear cycle.
mm. I hope that gives people so much hope because our awareness is such a powerful gift that we have. And then I feel like this gives the option and just opens us up to the possibility, whoever is resonating with this, and we all have had, like anxious thoughts and certain tendencies, and for some of us, like you said, it's more debilitating. I hope it offers so much hope that there is a way forward. And in your work, have you seen, have you and been able to help people through this cycle and to feel more free in the face of OCD.
Absolutely. I wouldn't be doing this or I wouldn't have written my book if that wasn't the ultimate goal. And the thing
Yeah.
is, the gold standard treatment for anxiety disorders and obsessive compulsive disorder is exposure therapy. More specifically, exposure and response prevention therapy. And what that means is that it teaches you how to confront your fears in a safe, contained, stepwise manner.
Mm,
Because the thing about fear is that when we don't confront it, two things happen. Number one, we're not getting the corrective feedback that our fears actually aren't that terrible, right? And then number two, we're giving power to the thoughts
yeah.
rather than empowering ourselves to be able to overcome and meet these thoughts. So, exposure therapy helps you to confront those intrusive thoughts in a way without doing anything about it. So, that's the response prevention part, without reacting with compulsions, without
Mhm.
reacting in avoidance, without with reassurances so that, yes, are you going to feel anxious? Of course, you're going to feel anxious. Why do you feel anxious? Because you really love your role as a mother, or you really love your baby, you love your children, and you care. That's why you feel anxious. However, just because you feel anxiety doesn't mean you have to do anything about it. Anxiety is information to us, and it doesn't mean that you're in danger.
Yeah.
So, being able to sit through the anxiety, learning to tolerate the anxiety, helps you to build resilience.
Mm.
Because as a mom, we need a lot of resilience. We
Ew.
need a lot of capacity, and we definitely need to limit the intrusive thoughts rather than be prisoners to them.
Hmm. Absolutely. And I found this since becoming a mom, because I've had like anxiety on and off throughout, well, for a long time, since childhood, I can remember it. But as a mom, I also feel like a sense of responsibility, but also opportunity to be able to
Yeah.
shift that within myself, because I also want to model like to my children how to
Yes.
embody these skills, and they're little sponges, as you know. So
Yes.
by me being able to know these tools and model them, it's very
Mhm.
cool to see in real time how it impacts them, you know?
Absolutely. You said that so beautifully because it's true. I don't know of any moms or fathers who don't feel anxious in their parenting role.
Yeah.
Remember, we weren't given an instruction manual of what to do. And even if you were given an instruction manual, because there are so many parenting books out there, each child will come with its different personalities and needs and what works and what doesn't. Even though I have twin boys, they are completely different and I have to parent them differently.
Hmm.
So I don't know any parent who don't experience anxiety. And again, that anxiety is only signals that this matters to you.
Yeah.
And what differentiates how parenting works, it's okay, despite the anxiety, how are you responding? How are you showing up? Are you still able to be present in your interactions and your engagement with your child, or do you then go off the deep end because you're so consumed by anxiety?
Yeah.
And it's important for children to see us being anxious and see us navigate how to resolve it, right?
Yeah.
Because then we're teaching them that being anxious isn't a problem.
Hmm.
It's part of being. What you do with anxiety is the most important part. And that will determine whether you are resilient or not.
Yeah. Ah, that's so good. Yes. I, yeah, this conversation I feel is so important, and I'm just so grateful for you for shedding light on this. I would encourage everyone to read Dr. Jenny's book, um, because it's going to walk you through a lot of this and help you feel not alone either, because you're not alone. Like you said, it's more common even than we realize. So thank you for,
Absolutely.
yeah, thank you for sharing more about it and reducing the shame on the conversation. So important.
Yes. And, that's exactly why I created the Stress Less Mama Masterclass because, you know, being a mom, you're going to be stressed. The question is, well, can we lessen the stress? And how do we keep our motherhood sustainable? Because when you become a mother, your capacity changes, your limits changes, your intentions changes, your values and what matters to you is going to change.
Mhm.
How do we keep motherhood sustainable and reduce that stress. So, my work with a lot of mothers coming through my treatment center, the Renewed Freedom Center in Los Angeles, that's what we do. We help mothers navigate through the perinatal motherhood journey so that you can meet motherhood challenges in a more sustainable way.
Mm. Yeah, and we will link the masterclass down below as well. And I would definitely encourage you to check that out and listen to it if you're in this time of your life. So, Dr. Jenny, thank you so much for coming on the podcast. Where can people find you, connect with you if they have questions or just want to share what their takeaway was from this episode?
Absolutely. Yeah, you can find me on dryip.com, also on Instagram, YouTube, Facebook, LinkedIn, all of the
All
different
the
platforms
places.
that exist today. Right. And for tips and tools, please listen to the Stressless Life podcast, which I actually had to take a hiatus on when I had my twin boys, and I'm just resuming that now. And then also, if you're looking for a provider, a mental health provider for specialized treatment of OCD or even perinatal anxiety and OCD, I would highly encourage the audience to go to the International OCD Foundation, which is iocdf.org, as well as the Anxiety and Depression Association of America, which is adaa.org. And there are therapist directories that you can find someone in your local area.
Okay, thank you. Thank you for sharing those resources. And maybe I'll even see if they're a Canadian equivalent as well. I know a lot of listeners actually are from around the world, but I know we definitely have a lot from the States. So thank you for sharing those resources as well.
Of
Yeah.
course. And I think there are going to be people, providers in Canada in those directories.
Oh, wonderful. Well, thank you. Thank you so much for coming on. I really, really appreciate you taking the time to be with us.
Yeah, thank you so much for having this conversation and bringing this to light so that more moms can find the support they need.
Thank you.